The Uganda Nurses and Midwives Union is up in arms. They're wondering how the government was able to secure vaccines. They're wondering how government was able to buy all this equipment that we've been using to curtail the spread of COVID-19. And yet, the people who are manning these equipments, the people who are in charge of distributing the vaccines, the people who are in charge of administering the COVID-19 vaccines, were not being taken care of. That is the biggest contestation. We earmarked too much money for the COVID-19 response and not any money for the welfare of the individuals who are actually going to get engaged in this fight against COVID-19. So last week, the Nurses and Midwives Union accused government officials of intimidating its members who are currently on strike. But the country is shocked. Nurses and midwives are on strike considering the amounts of money thrown at the medical sector during the COVID-19 pandemic. To speak to us, we have Justice Cherop. He is the president of the Uganda Nurses and Midwives Union. He's not alone. We also have Sister Annette Birungi, the treasurer of the union, and she joins us right now with the main man himself. A very good morning.
Good morning.
Okay, what I want to understand is we spent a lot of money on the medical sector. So why are you on strike, Mr. Cherop?
Yeah, thank you very much, viewers. I am Justice Cherop, the president of Uganda Nurses and Midwives Union. Maybe I remove my mask.
Indeed, it's stifling your ability to speak.
Yes. Why we are on strike is that we have all along been asking for lunch allowance. Because we are ever there in the hospital, we don't go for lunch, we don't break off for lunch. Patients cannot say, we are waiting for you, you go for lunch. But for us, we say, no, we shall eat that lunch. And this lunch is a top-up lunch, which we currently have 3,000 and per day. And that lunch, with the economy of this country, it cannot help us right now. So we requested in 2018 that please increase us lunch allowance by 12,000. And the cabinet accepted that time, and it did not come on 2019 budget. But 2020, we also warned the government that we have not got this money. But then the government did not realize this.
Okay, this is what is happening. I just don't want our viewers to get lost. Let's say there is a security company at company X, and now the owner of the company gives this security guard a new gun. You're going to spend lots of money to buy this security guard a new gun. So the security guard is going to wonder, where did you get the money to buy me a new tool to be using during my work, and yet you're not giving me 2,000 shillings, 5,000 shillings for lunch allowance? Why? So that's what we are dealing with right now. The security guard was using a rifle. Now they were giving an SMG. So the security guard is wondering, where did the money to buy the SMG come from when my lunch allowance has not been worked on? So that's what we are dealing with right here on Morning at NTV with the Nurses and Midwives Union, who are contesting the government's inability to pay their lunch allowances. Sister Annette Birungi, didn't you receive a coin of this money? It was earmarked. You've been looking for it since 2018.
Yes, it's true. We have been looking for this money since 2018, and we managed to seek an appointment to meet the president.
Maybe you can remove the mask and the viewer could be able to hear you.
Okay, let me remove my mask.
Indeed.
We managed to ask for an appointment to meet the president of Uganda in 2018, and we were promised this money. We negotiated, actually we wanted 20,000 because you know the situation today. But we negotiated and the cabinet accepted 15,000. It has been in the newspapers. Even there is a time when it was, you know, allowances came out briefly in the circular standing instruction number 6. And they said the nurses are going to get 15,000. And unfortunately, we waited, it was not put in the budget. And we know Ministry of Health always present the budget, but we don't know why this has not been protected. Yet it is a government, it's a president pledge, because the president accepted on our International Nurses Day. And the minister herself was there. So we expected her to continue supporting this 15,000 and presenting it in the budget of health. But up to now, we have not yet received it.
Justice Cherop would like to know, in Uganda, some of your colleagues have been threatened to be fired.
Yep.
What is happening in Ibanda? And aren't you afraid that many of your colleagues are going to lose their jobs?
Yeah, thank you very much. It is a national concern. And I believe that, and even the union is warning those people who are threatening them, because that is their right. The right of the worker is to demand, and we gave the government enough time to look money. This time we gave from October. We want the government that it should appear in the budget. But if they are threatening our members, the union has the right to deal with those who are threatening the members, because it is their right to lay down their tools. And even according to the constitution of this country, it says that if you want, you have the right to lay down your tools if your needs are not being catered for.
But Justice Jerob, if they lay down their tools and they have maybe COVID-19 patients they need to take care of, don't you think this will have a detrimental effect in the country's fight against COVID-19?
Yes, it is. It is. But of course, that is where now government should come in very fast to rescue the situation. Because our situation, you cannot be in COVID-19 rescuing patients with empty stomach. I give these people the example of soldiers. You cannot buy ammunitions and infantry go on fighting with empty stomach.
Don't even go too far. You cannot ensure protection from a security guard who has not eaten anything for a month.
Exactly.
But you keep them employing every day. Exactly. The next time they will shoot you, the owner of the business.
Yes.
But then what we would like to know, Sister Annette Birungi, Dr. Atwine, she is the permanent secretary at the Health Ministry. She came out and told us this money was budgeted for. Is there someone who is clearly frustrating you as the midwives, the nurses and midwives union?
Okay, when you look at the budget, they say the lunch allowance is a funded priority. And when you say that it was put in the budget, it means that maybe it was not supported enough, because there are so many things, there are so many changes and increase.
Supported enough, or someone ate the money? Because when we
no.
say it was budgeted for, it means it was earmarked, but it just didn't reach you.
I don't know what she meant exactly when she said that it was budgeted for, because for us, the Member of Parliament for Workers, Honorable Charles Bakabulindi, he brought it on the floor of Parliament, and the response was that the budget, the lunch allowance is an unfunded priority. So right now, that's what we know. And when it came to us like that, our money is not catered for, and yet we've been waiting, and we were promised in December. We have letters from the minister, from the Prime Minister. We really became so much disappointed. That's why we had to say there is nothing we can do, only to put down our tools so that the government can come out and look into this. However, I saw something like there is malice, you know, in that press release. Dr. Diana Twine talked about malice for top management.
Sabotage.
Yeah. No, that's not like that. But we are aware also that whenever they would present the budget on the committee, this was not always presented. So we've been wondering why this is a presidential pledge. Even if other allowances are not catered for, we should receive this money, because we are on the front line of COVID-19. Right now, the vaccines are not given because they are supposed to be given by the nurses. So if you purchase the vaccines and then leave the nurse hungry, and today you know very well that as nurses, or even everybody in the community, you need to be having strong immunity in order to fight the COVID-19.
So even you as a nurse, you need to boost your immunity maybe with a simple lunch as you work on the patient.
Yes.
Go ahead.
Yes, and let me tell you what is even disappointing more. The nurses, around 70%, I don't know whether the president of Uganda knows this, the 70% of the nursing workforce, the nurses working, receive 600,000. Though we got a salary increment, it is only 30% that get more than 1 million. So we negotiated, but we are not again satisfied because we wanted in ordinance to get 1 million by then. And we have been hoping that this money, once it is given to us, it will help us at least for that nurse to get rent, transport, school fees. You can imagine what we are going through. So we are not striking just for the sake, but we are looking at the life of a nurse who is ever on front line, looking at your health, trying to see how you are, and trying to prevent all the diseases. I put there my life every day. You put your life also for me, please. Yeah.
Mr. Chirop, the lives of the nurses, but what about the lives of the COVID-19 patients whom you've decided to neglect? Don't you think that is the biggest problem? Downing the tools and then putting the lives of those individuals you are mandated to protect in quagmire or a state of dire?
Oh, thank you. What I can say, we have already scaled on the staff who are dealing with emergencies. So, like maternity, like labor suit, like casualty, all the nurses are there protecting those patients. But the other ones, we are staying off because we need our demand to be accepted by the government. It was accepted anyway. But this, you know, this is very funny. The president gives a go-ahead. The prime minister gives a go-ahead. On Thursday, I was with the prime minister in a meeting, and the prime minister said, please, we wrote these letters. We told the finance ministry, please find the money. Put it in the budget, but they neglected. So for us, we are saying that we are very serious that we are staying out until lunch is provided. Yes.
Is there another amicable way we can come to a resolution? I'll just tell you the same thing that came in when I was talking to some very, very good lecturers from Makerere University who are also protesting. They need their money, the salary increment. But then I talked to them about how they can execute their duties while at the same time demanding for their money. Is there space for dialogue while you still execute your duties as nurses and midwives?
Yes. The dialogue is there when the government has come. First of all, we have engaged the 5 ministries already, but we said this is from last year, October, when we began this struggle. So we have been engaging the government, and up to today, we like dialogue. We don't refuse dialogue, but we say that no, if dialogue doesn't prevail, what next? Yes.
Sister Anne Birungi, doctors have supported your cause. Is this the kind of support that you need to succeed?
Doctors right now, they are on duty, it's true. And also our nurses are on duty.
But the doctors are supporting you. Is that the kind of support you need?
They are supporting us because they know that when we get, usually the lunch allowance cut across. When you give, because we don't work in isolation. So this lunch is going to be given to the, earlier along we thought it would be given to both doctors and nurses and necessity and other old people that working in the medical fraternity. But later government said that they do not have enough money because it was coming up to 100 billion and plus. So we said, okay, if that is the case, let's get 70 billion. Ministry of Health actually is the one which calculated that money, 70 billion point five, that they will give only the nurses, and then they give us in phases. So the way they are supporting us right now, I see them a bit, not so much. I don't see their support actually, because I have not seen them coming out to talk about it, only that I have seen the president of the association came out and he talked about, gave a statement. But that statement is, we expect also the union to come out. So when you say doctors are supporting our cause, I don't see it very well. But they are right. First of all, the entry doctor gets 3 million. You understand? And then for us, the other nurse I told you, the one
600.
is getting 600. So me, I was also thinking that these doctors wouldn't even mind, because 3 million and someone getting 1 million, if we or 600, if they add that 250 or 300, they will still work and wait. But if they come out and they also want, and also if the government knows that really all of us, we are equal and is practicing justice, let us get all the money. That's what I think. But I don't see enough support. And I really think we need, we've been asking the government to give us directorate of nursing. Because if we had a director also in the Ministry of Health.
To speak on your behalf.
To speak on our behalf. Like, for example, we have just a small department for the nursing, and even the nurses are very few. But all the directors in Ministry of Health, they are all doctors. So I don't know the support we are getting, but we are still fighting. We are still, okay, lobbying. We need nursing at a very high level. We need a nurse to be we need a voice for the nurse, yes.
We need to improve the welfare of the nurse. Yes. All right, thank you very much, Sister Annie Birungi. Also, Chorab Justice would like to know, last week the Uganda Nurses and Midwives Union came out and said President Museveni is not to blame for all this. It's not like, it's like you're saying President Museveni is not in charge, yet he's the one who made the pledge.
Yeah, we don't blame the president because in 3 occasions the president has made a pledge. We had him in Kitgum. He told us, we requested him, he said, please, these nurses deserve lunch. 3,000 is not good. We had him in Tungamu. He again directed the ministries, the PS, the Minister of Health, that please put in the budget. These people deserve lunch because they work. Now, we don't blame him. The Prime Minister, on behalf of the President, wrote a letter dated December 31st, that please hold on, we are going to work on it. Now, sincerely, if the 3 arms of government accepts something, who are you to defy it, not to put in the budget? So there is something wrong within either Ministry of Health or Ministry of Finance.
Mr. Justice, if I promise to buy you a bicycle at Shop X, is it your job to actually go to the shop and demand the bicycle, or is it my job as the person who promised you to go and tell the person at the shop to give you the bike? What we are saying is, shouldn't it have been President Museveni's job to fast track this money on behalf of you, the Uganda Nurses and Midwives Union, rather than you going to the ministry that was mandated with the same?
Yeah, we have 2 pledges from the president. One pledge was SACCO money, 1 billion. He said, oh, nurses, you are doing good job. I want to support you with 1 billion shillings. So for us, we are waiting because that was his personal pledge. But the lunch allowance was the directive. It did not, this one was not a pledge that, I will give you, but he said, please do this. But the SACCO money is his personal pledge. That's why we don't follow it up, that if he thinks that we deserve that 1 billion, he gives us.
So you still haven't received the 1 billion for the SACCO?
Yes, we still need him to give us. But if he doesn't, because it was his money, let it be with his money. But this one is for working.
But you need to remind him in case he has
But
forgotten.
we have reminded him several times.
Yes, yes.
And I'm sure maybe as he comes in a new term,
Indeed.
he will think about it.
And he's watching. He's going to watch.
Yes, I am glad that he is coming back, and we shall celebrate his coming back. And I know he will give us that money.
All right.
Yes.
Justice General, besides the issue of creating a directorate for the nurses, what other resolutions could we come up with to improve the welfare of the nurses?
Yes, 1, creating the directorate is number 1. 2, is the government to listen to us. And also government should stop intimidating the nurses. And
Government is intimidating the nurses.
Yes.
Explain.
Yes. Now, as you are saying, Ibanda, I was talking yesterday in the radio of Busoga. They were intimidating our nurses in Bukiri, that please, if you don't work, we shall chase you, we shall do this, we shall arrest you. I told the RDC that this is a national concern. It is, even Parliament knows it. Even the President knows it. So what we need is the money. Where is the money? If the money is not found, come to us and say, please, money is not found. But we don't hear from these people. Sometimes we go crazy because they don't come back to us. We are very polite and we are professional. If you think that there is no money and we have requested and you have pledged,
Say something.
please say something and say, please, hold on. we are going to look for it. We shall understand. But now if you keep quiet until we wake up and say, no, wait, let us do this and that.
So it's because of the uncertainty, because that's why you decided to down your tools.
Exactly.
Because there was no kind of information
There is
coming
no
in from the other
information
side.
at all.
So the directorate, intimidations, go ahead. We are talking about resolutions.
Yes, directorate, intimidation, and then, of course, false accusation by politicians and threat. Politicians can come, bring the patient, you tell them that, hold on, I'm looking at this line, and then you come, the other one goes back and say, oh, let me write to the cow, to LC5.
Order
to
from
chase,
above.
Yes, to chase the
Transfer
nurse.
you.
And you find that the nurse is chased or transferred. Right now they are transferring nurses because they are striking, which is not the case, which should not be there. So now another solution is that health should be a priority. In any government should be a priority. And I'm advising the parliament, the coming parliament, that health should be a priority because we need health. Everybody needs, even those ones, we don't want them to be transported to go abroad for treatment. We need them here. And we are the ones to give them treatment. The nurses, the doctors are here. So health should be a priority.
Such factors that precipitate the brain drain that we are seeing. Many of the nurses, the doctors themselves leaving Uganda and deciding to go to the Middle East or these other countries to offer their expertise, but not their own country, Uganda, because of the problems we see right now. Is that the reason why people leave the country to go work elsewhere?
Now, why would people leave this country? One is the motivation. You know, if you pay a professional who read books for 5 years or 3 years, pay him well and look after him. You know the challenges we have. Houses, you travel alongside, you live in Entebbe, but you are working in Mulago. You live in Mukono, you are working. Because why you are living in Mukono is because of the money. You cannot afford the rent in Kampala town, so that you quickly go to Mulago. So you feel that the life is very disturbing. And two, why these people are running away? It is not only that they were their welfare. It is also the politicians. The politicians have taken off professional issues because a politician just decide and say, this one should not be there. Even the job creation, you find that when they are advertising the jobs, you apply, but politicians can come in with their people and say, let me push my person. So you find that the right people are not in the right positions.
Indeed.
Right now. You find that now we have a position of ADHOs, assistant district health officers. But there are other districts that they are waiting for their sons to qualify to come for the same position. We have complained that you people, please advertise the jobs, but they are not. So what do you expect a qualified person? He has to go because there is politics alongside that. And I like the president's statement when he said that this time there's no joke. I like that because I know that this time he comes back and he will do something.
Just as Cherop is the president of the Uganda Nurses and Midwives Union, we also have the treasurer, Sister Annette Birungi. Sister Annette, let's talk about another issue, whether or not this government has actually learned a lesson or two during the onset of this pandemic. What we saw in other countries was a clamor, all countries running to actually talk to the frontline workers, help them with the incentives that they needed to aid them in fighting the pandemic. But here in Uganda, we saw the opposite. Do you believe this government has learned a lesson or two from the onset of the COVID-19 pandemic when it comes to bankrolling the health sector or even the people like yourself who are on the front lines?
For me, I think the country has not yet learned a good lesson because when you look at the way how they have handled our matter, for instance, the health workers started talking about this lunch allowance. And
before the pandemic?
Yes. And you are making a budget, you are busy purchasing vaccines, busy doing ABC, saying that we are trying to work hard. But look at the person who is going to use whatever you are doing, what you are purchasing. You can buy the ICU beds, you can, but you need to be in a very good dialogue with the human resource. I'm a manager. I have master's in management science. I did postgraduate diploma in hospital and healthcare management. I know that I know that human resource is very, very important in healthcare delivery. So if I'm not talking with you, and I am talking but you're not listening, I'm a worker, how do you think you're going to change the service?
But largely
so
they are listening and they are watching.
Yes,
so
I
make
really
a humble
think
appeal.
they should really be close to us. We started alarming, but I've never seen anyone. Like, for example, okay, we had a dialogue, but in most cases you find that Ministry of Health is presented. We've been having a dialogue with the Ministry of Public Service.
All right.
About our
welfare.
And the ministers are called and they send commissioners that they are busy.
So there's been a lack of information trickling down to the person needing it the most, the nurses.
And the other thing that is actually affecting healthcare delivery is the structure.
The structure?
Yes, the structure is bad.
The structure is really, really terrible.
The population right now, we are 44,000.
And we've run out of time. Many thanks for having made the time to speak to
people.
Morning at NTV. We are 45 million. Thank you very much, Justice Chirop, the president of the Uganda Nurses and Midwives Union, for coming through. Sister Annette Birungi, thank you too for coming through. I'm sure the government officials have been watching and they will offer reprieve in the nearest time possible. Stephen Mbide is on... He's on live. Stephen Mbide, very good morning. He has the latest this morning. Very good morning, Mbide. Where are you and what's happening?
Bulange here in the Luchiko building here in Bulange Mengo. But we know that Luchiko will be, the Buganda Parliament will be opening this morning. And to help me understand the essence and the importance of
my brother Stephen Mbide is grappling with some technical difficulties right there, but as far as the COVID-19 pandemic is concerned, this dear country of ours is grappling with some 42,355 cases of COVID-19. The good news is 41,000 and some 924 people have actually recovered from the novel coronavirus. On the international scene, we are now talking about 157.9 million plus cases of COVID-19. The US is taking the biggest chunk of those cases with over 32.8 million plus cases of COVID-19. India, 22.6 million. You have Brazil with 15.1 million plus cases of COVID-19. You do have France with some 5.7 million plus cases. So when we tell you, please wear a face mask before you veer into a hot concentration, it's not because we want President Museveni to call for another lockdown. It's not because we want the health ministry to call for another restriction in that regard, but because we care for you. We care for your well-being. Yes, in that regard, wear a face mask as you veer into a hot concentration. To all the kings, queens, boys and girls who are celebrating their birthdays on this